There we go. Share my screen. See if you guys can see this, right? Just I'm going to leave the chat open. If you want to say anything, you can put it in the chat. Well, I'd like to welcome you. I don't know, we've been doing these for a long time. I do one of these a month because it's kind of fun to do, and I appreciate all of you taking time out of your family time and your clinic time to do this. I like the idea of doing it virtual, and I've gotten a lot of good feedback. To make it a little bit easier, if you can see here, I put together on the Practice Mastery website the future master classes. So the idea is every other week I'm going to do one based on the patient presentation. So November I'm going to do an Achilles tendonitis one. Then I'm going to do a year-end review, kind of how to do a big experience transform for the whole year. Then I figured out the whole 2024. I basically put this down because recently I was at a place and they did this for the whole year, and it just made it easier to plan. So if you're interested in any of these, we're going to do it on hallux limitus, then practice management, then shockwave, then flat feet, then YouTube, then warts, then orthotics, then forefoot pain, then biopsy. So stuff like that. That'll be the year for next year for these. I do them once a month. They're limited to 30 people. So and we kind of sold out, right? It's for free. How do you sell out when anything's for free? But we sold out this week for this one. So let me get going. You guys can ask any questions if you want in the little chat. I'd like to know who currently has ultrasounds. If you could just say, yes, I have an ultrasound, or I have one and I'm mad because I don't use it enough. Write that in the chat box, what your thoughts are on ultrasound. So Joel has an ultrasound. Yes, and I'm not using it. Yes, and not using it enough. That's how I was. That's why I'm here talking about this. So good. Yes, and I love it. Marty loves it because he's the rep. Yeah, Joel, all the time, 10 times a day. That's great. Now, who lives in a state where ultrasound is covered by insurance? Who the poor man's MRI. Yeah, the poor man's MRI. So it's covered for Dr. Marty, DC, everyone's covered, Marty's covered. Okay, those are good things to know. Now, I'm in Massachusetts. Medicare is covered. Some of the other ones are covered, but Blue Cross, our big payer here, isn't. And I'm going to explain kind of how I get over that. So let's get into it. We're going to talk about how to improve outcomes and profits with ultrasound. If you stay to the end, I'm going to give you the bonus. Basically, I'm going to give you all the slides, and I'm going to give you all my ultrasound training notes. These are what I'm giving to the new doctors in the practice, and I'll show you kind of what they look like as we go through this. This is something I know I'm trying out. So if you guys are interested in this, everyone's been asking me questions via email, and I set aside some time in my schedule. I call it a strategy call. It's free. Because I think it might give me fodder for other ideas. So if you go to Podiatry Practice Mastery, go to products, there's something called the strategy call. You can pick a half hour. We can meet together, talk about what you want to do to get your practice to the next level, friction points, overcoming specific challenges. I'll give you as much of what I can in 30 minutes. And, I'll guide you to some resources, hopefully. For those, there's a special deal for this. Some of you have already done this, I've seen. Instead of $97 a month for the first 2 months, I'm doing it for $20. And what I find for this Practice Mastery Academy, it's everything. It's all these recordings. That's where they're going to be at afterwards. All the previous master classes. So what I'm finding what people do is they give me $20 for 2 months. They try it out, and then most people just stick around. So just to make it enticing, I'll give you the link afterwards for that if you want to join and just try it out. Okay. So this is for you if you have an ultrasound and you want to learn it more, learn to use it more effectively. If you're not comfortable with doing ultrasounds and don't know how to explain it to patients, if you're thinking about getting an ultrasound, but you want to make sure you can pay the bill, it can be a big chunk, especially if you have a better device. And if you feel like you could use it much more to earn, but you're not, that's what a few people mentioned in there. And if you don't have an ultrasound, this isn't for you if you're a cheapskate. So if you're not willing to buy one, don't waste your time here. If you don't know how to use an ultrasound or know anatomy, you can take a course. I'm not going to teach you. I can't teach you in an hour how to do an ultrasound, but I'll give you some tips that worked for me. I guess one of the tips is having someone like Dr. Marty who can kind of teach you and guide you and give you resources. There's other things though, and how to feel if you feel like ultrasound is not helpful for treatment. I know sometimes we think that MRI is a go-to, but I actually prefer ultrasound many times over an MRI in the office setting. So we're going to go over today how to choose an ultrasound, something I call block timing, pre-framing patients, why I do it after my first visit, not during the first visit, using it for injections, how to talk about money and wording. I have to do that in Massachusetts because for many of my patients, they're all paying cash for it. Wow factors, how you use it with patient presentations. I have an actual ultrasound presentation. If you haven't looked at it, I'll give you a link to that you can use. And then how to make documentation easy. This is the most boring part, but how you can do it a lot easier. I don't document anymore. I have my scribe documented, but I'll teach you the kind of what they use. And then I'm going to give you my ultrasound presentation and documentation. You stick around till the end. So what's the problem? The problem is we don't do ultrasound more because we don't offer it. And we don't offer it because many times we lack confidence or we lack a process. So this is the 4 C's. And I learned this from Dan Sullivan, a gentleman that I've been coached with it's been going on 10 years. So the idea of the 4 C's is this is the process of getting confidence in anything. First, you have to commit, and that just means you commit. And usually, the best way to commit is actually paying money. So if you pay money to buy an ultrasound, that's a good commitment. So many of you have already paid the commitment if you have one. And then you do courage. So you have to take courage to do it. And then only after that, you're going to develop capabilities. You have to practice the thing. You have to have courage to practice it. And I'm going to give you a couple of tips that's helped me in the beginning. Then you're going to get more capable, and then you're going to have confidence. So right now, those that are doing it, let's say someone said 10 times a day. I think I do it maybe, 3-4 times a day with my patients. Then you develop more confidence on using ultrasound. So that's where I'm hoping we're going to be at. Let me just show you. These are my numbers recently. So I had my staff run something here. So 2021, I think this was the previous one. So 2021, you can see like maybe 3 a day, a couple with 1 a day, 2 a day. And I'm doing the majority of them. And what you're going to see here is the charge. So the charge is usually $100 if it's one side, $50 if it's an ultrasound guided, and then I guess $200 if it's bilateral. This is the expected amount. And then this is the payment amount. And the things that are the odd numbers, not the even numbers, like the even numbers are the cash payments that I got. So $100, $50, $100, 100, things like that. And then, so if you, out of 202, it was $15,000. Okay. So, we charged and then what we get paid. So that's pretty reasonable. I kind of say it's about, $100 per ultrasound. This was another one. I think this is this year's, so the other one was 2021. This is 2023. So it was 107 of them that we did. And so we got about $9,000. So that's about $100 per ultrasound. So that, I know it doesn't seem like much, but in the end, if you're doing, 3, 4 a day, it can add it up. Okay. And a lot of mine right now are just cash pay. Okay. These were just the ultrasound injection ones. These are the 50s. And then when you get up there, you do the ultrasound, the non-injection ones. So I always like to start with stories. Kind of, that's the thing I like about this this thing with Practice Mastery is I just get to share how I've messed up, and then usually other people are helping me to get better, and that's what I like about doing this. And I just like to help others because we don't know everything, and we want to help each other get better. So I always wanted to have an ultrasound. I remember this was back in the residency day when I used to read the annals of podiatry management. They always talked about ultrasound, and I went to the courses. I always saw them. I thought they were cool. Then I got one, and I didn't really know how to use it that well. The reason we got one is because we got a new provider, Ben, who's one of my partners, and he's like, "Oh yeah, guys, you have to have it." And we're like, "Okay, we'll get it." And now we have 2, one at each of our offices, but I didn't use it that much because I wasn't that confident. And then, and then I ended up asking my librarian, and so we have a librarian, and she got me articles. And so instead of getting a book, because I was a cheapskate, I got some articles about how to do ultrasounds in the lower extremity. And then the key though is I used block time. And then the other key is I added it to my presentations. And I'm going to explain how I did both of these. These are both the big levers that really made me use it a lot more. And now I do it a lot. So that's kind of the backstory, but the key is block timing and then adding it to your presentation of how you typically do things, and you explain things over and over to patients. Okay, so let's start looking. How do you choose a ultrasound? I am not paid, and I'm not getting paid for this. But let me explain. How do you choose it? I'm going to tell you what we did. First, you want to see if it's reimbursed by insurance. Okay, in Massachusetts, there are some that are, some that aren't. For us, Medicare does. Then Blue Cross Blue Shield. What happened is they would cover us, but we had to like submit so many cases and we had to pay so much money every year. It wasn't worth it to do Blue Cross Blue Shield. So I don't know if any other people. And so they said basically you just can't get paid from us to do it. So that's why we don't do Blue Cross Blue Shield. If I'm understanding that wrong, anyone, please reach out to me afterwards. But in Massachusetts, so a lot of times we're just telling people we have this list and my staff know, and they know who covers it, who doesn't. I don't know. They just tell patients. Okay. It doesn't really impact what I do. You have to kind of determine, this is what we wanted to determine. We wanted to determine if you want a mobile one or a PACS system. Okay. And they can go from anywhere from like this little mobile one for $5,000 up to a real good one like we have, which is about $25,000. And set up visits to compare products. So that's what we did. So if you're not using one, I would call a couple of vendors, have them bring the machines over and have them let you try them out, and you'll be able to see the difference. Okay, that's the key, is seeing the difference between the products and also the ease of use. What I really like about ours is that when we take the pictures with it, it automatically goes over to our PACS system, which is our same as our X-ray. So I can look at it in each office. I can look at it wherever I'm at, and I'll show you a couple of the images later on. But you also see the quality of the image. Like this looks like bad black and white TV. This one on the left and this one here on the right looks a little bit better. And oh, look at that. Martin's name is on there. Must have stole that from someone's website. But this is the one that we have. It works well. My only qualm about this one is the battery. So the battery, after, gosh, maybe a year or two, died, and we had to buy this backup battery. And then it always seems to, once in a while, you don't click the right amount of buttons and it dies on me. That's the only thing, because the battery is like the size of a pea. But other than that, and we don't have a, like, if you had an ultrasound suite, you would only do them in one room, but we have 6 treatment rooms. So we're leaving this in the center, and then we're moving it to room to room to room as we need it. And so some days it's kind of a pain that we have to plug it in. But a lot of times the battery works. And but the pain is like, because we're going from patient to patient. And so if that 2 or 3 minutes to like plug it in, get it powered up a little bit, turn it on, put the name back in there, it can kind of be a pain. So that's my only qualm with our machine, and maybe we're doing something wrong, but that's kind of the issue. Besides that, it's a good machine, and we have 2 of them, not just one of them, that kind of look like this. So that's how we chose. So we had 2 different companies drop off machines, and we tried them out. And basically, I think it was Ben that helped us to decide. We decided, and another thing also is, if you're a single practice or if you have multiple doctors, like for us, we probably paid the thing off in a year and a half, because we had 3 or 4 doctors at the time, and then we're all using it at different quantity of times, but we're using it differently. Okay, so my big tip is block time. This is what I did when I was starting. I had all the patients come in at the same time. So my block time was Wednesday. I think it was Wednesday afternoon. So everyone Wednesday afternoon. So I was seeing all of these, let's say, plantar fasciitis patients, and I said, hey, I'm going to see you next Wednesday. We're going to do an ultrasound, or my Achilles tendonitis, or my ganglion cyst. So I put them all on the same time. And so I did this, gosh, it was probably a couple of months. So let's say 8 sessions. And then I was seeing like 5 or 6 ultrasounds. And so that got me really fast at doing the ultrasound. Isn't the hard part, frankly. The ultrasound is the easy part. The hard part is labeling on the ultrasound. It's like all the little, like putting the right, left, longitudinal, horizontal, medial, lateral, all that stuff. That's kind of the hard part. You have to get used to clicking things, unless you have someone. I don't have someone else to click stuff. I'm clicking it as I'm doing it. I guess it was Wednesday morning. That was my block time. And in the beginning, the other thing that I did, because I didn't really know what I was doing, I said, I'll do it for free. So let's say I had some time and I had a patient in there, and I said, I'm learning how to do an ultrasound. I'm not going to charge you. Can I just do it? So I think in the beginning I was doing everyone for $50 instead of $100. And so I just did everyone for 50. We did the same thing when we were doing shockwave in the beginning too. We did it for the first like 3 months for, I think it was maybe $100 per shockwave for each session, let's say for three months. And then once we figured out that it really did work, then we upped our fees. And then you also want to see if the company has a physician. So what happened with our company, they came in, they programmed the machine, they taught us how to use it. They didn't, yeah, the only way to learn is really practice, but they taught us like how to like put like all the code, like the stuff in, like the proximal, distal, medial, lateral, all the stuff on the screen. And then they hooked it up, which is the hardest thing. They hooked it up to the PACS system. And sometimes that's I'm going to go for another drawback, because I like to be pretty clear. The other drawback is sometimes we finish the exam, I hit end, and it doesn't send it to the cloud right away. And so then I have to, like, I'm in my other office, pull up the PACS system, and it doesn't show up right away. So they have to like re-push it through, or they have to wait. I don't know, for some reason it has a magical time when it throws everything up into the cloud, and then it shows up there later. But that's another struggle. So sometimes in the beginning when I was doing it, I had to, I wasn't documenting at the same time. Right now I document, but before when I was learning, I wasn't documenting at the same time in my note. So what I would do is I would do my note later. I would go back to the ultrasound, pull up the image, and I would document based on the ultrasound. What I do now is while I'm doing the ultrasound, I talk, it sounds like I'm talking to myself, but I have a scribe, a virtual scribe in my pocket. And then Murali is documenting as I do it. Now, one thing I'm going to share with this afterwards, but if you click, when you get these slides, if you click here, this is going to go to my new doctor manual. So you can all have access to this. It's a Google Doc it's like a living document that I continue to work on. But this is a doc that we were training. And so here's an article about musculoskeletal foot and ankle protocol of doing ultrasounds. I talk about how to label, how to hold the probe, and I learned this from someone else, Dr. Marty. You want to put there's a little BB thing on one side, and that always goes proximal or medial on the foot. So just look at that. Isn't that a nice looking foot? I have the best looking feet in the practice, by the way. There's the other guys have like hallux limitus and stuff, but I got good looking feet. Here is the heel, how to do it medial and how to do it proximal, where the dot is. So I'm explaining how to do that. When you're saving it, this is the part that takes a while. You have to kind of equate yourself. And then this is the key. This is kind of the pain. You have to do like left, longitudinal, platyfascial. So the way I do it is I do the side. Is it transverse or longitudinal? And then where the location of the anatomy is. Then I put also proximal and distal, or medial and lateral. And then I usually measure it. Here's the measuring thingy, and it says how big it is. And so if you're going to do, for example, an ultrasound guided cortisone or something like that, or an amnio, you're going to kind of come out where it's the blackest, which is an effusion, or where it's thickest. And this isn't a very thick one. This is 2.6 millimeters. So that's an example of a plantar fascia. Here's an example of a transverse view. Once again, I'm not going to teach you guys this because you guys all know anatomy, but yeah, I put in, once again, this. So another thing, and on my screen, this side of the screen is always medial and lateral, or proximal distal. So there's just these ways you figure out how to do it. This was a neuroma to the interspace between the third and the fourth met head, and I kind of measured it. So that's another one. Here's another Achilles tendon. You can see the thickness of the Achilles tendon, 9.1 millimeters, longitudinal, proximal, distal. That's another one. Here's another Achilles. Here's a bulbous change to an Achilles. You can see all this black stuff in here. And this is my big explanation piece. What lax and sax? What's that? Scott, tell me what that is. What the heck? Okay, anyway. And that's for Achilles bulbous change. And then here's one. So anyway, these are just examples. Here's a ganglion. So here are these things. So just examples. You can look at that afterwards if you want. Okay. So going back to this. Okay, that's the if that helps anyone, that's great. So that's the learning. Here is the pre-framing for patients. Okay, this is how I do so much of it. Okay, I say these words. Thank you. Longitudinal and sagittal. Thank you. Longitudinal axis and sagittal. Okay, pre-frame patients, what to say. I always say, here is an example of an ultrasound. It will show the thickness of plantar fasciitis, Achilles tendon, whatever I'm saying. We're going to start treatment. We will start with treatments today. And at the next visit, we will do an ultrasound. This is the way I do it. Okay. And I'll explain how I share that with patients. I can see the soft tissue with an ultrasound, while an x-ray can only show the bone. And we can also track how your tissue improves with ultrasound. That's what I like. So with ultrasound, I'll do it, and then I'll do it. Let's say they do a course of shockwave, and then I'll see them 6 weeks after. Then I'll do another ultrasound, and I can compare. And the other big thing, I know it's obvious, but I'm just going to tell you guys, is that I always do bilateral. Like for plantar fasciitis, I'm going to do it. Let's say the right foot hurts. I can show them the right foot that's very thickened. There's an effusion in it, right? And then on the left foot, you can show them that it looks more normal. Like that is the biggest selling point for any type of treatment, is showing bilateral views. And if it's bilateral, though, it doesn't always mean I charge for the other one. A lot of times I'm doing it just to show. Okay, so I'm not going to charge them for both. This is how I say it, and this is the presentation that I use. So let me explain this. If you haven't heard of these are my patient presentations, which I kind of put together, and I give these out. Some people ask me why I give them, just because I use them, and I figured if it helps someone else out, it would be beneficial. So what this shows, this is, I say to the patient, this is the diagnostic exam. We usually do an x-ray. Even if there's a spur, it doesn't really matter. We all have that conversation all day long. How come I have a spur here? I say, but what makes me look at it better is with an ultrasound. Here's an example on the right foot. Here's an example on the left foot. You can see the right one is thinner than the left one. And this left one is blacker or darker, and that's because there's swelling in there. So the plan is, if you're not getting better with these current treatments, at the next visit, we're going to do an ultrasound. And I do that for a couple of reasons, and I'll get into those reasons why I don't do it the first visit. Okay. The first one being is it's not covered by insurance. If it was covered by insurance, maybe everyone would get the first visit. But we'll go over that in a second. So this is how I use this slide. I would say this is my money slide, if you want to call it. This is my money slide for doing ultrasound. Okay. And then my next slide is this one. And this is within the patient presentations. And if you don't have a link, you can go to patientpresentations.com. You can get all these. You can use them if you want. Okay. So the way I explain this is I say, okay, Mrs. Jones, there are certain treatments that are most effective, others that are least effective. Most of my patients try this stuff underneath the yellow line before they come and see me. Okay. And we want to focus on reducing the pain, reducing the tightness, and reducing the stress through your foot. Okay. And then I say, and then I usually start them, however you guys do it is fine, but I usually start them maybe with an anti-inflammatory. The reason I do that is with an anti-inflammatory by prescription, I can bump my office visit to a level 4. Okay. Because it's medication management. So I have a template for that. They might do icing. They'll probably do icing. I'm going to teach them how to do contrast baths. They're going to do foam rolling. I like foam rolling more than I like stretching. Foam rolling. They're going to do a morning stretch with a towel. My staff teaches them. And then they're going to do the night splint, usually because they have equinus, right? You can't do it based on plantar fasciitis, but you can do it based on equinus. And my staff currently calls this the Pelto special. So every time everyone comes out, I come out of the room, I say, they're going to get the Pelto special. And that is, they get them a night splint. They show them foam rolling, and they purchase a foam roller, and then they teach them a towel stretch. Okay. Then they're also, maybe doing an UFO sandal or an appropriate shoe, and then based on the x-rays and things like that, then I may do an orthotic the first visit. And then I say, and Mrs. Jones, on the next visit, when you come back, we're going to do an ultrasound. And based on the ultrasound, that helps me determine if I'm going to do cortisone or shockwave. And usually if there's thickness or an effusion in the fascia, that's where I'm recommending more of a shockwave, because it does a better job at healing it than the cortisone. The cortisone might make it feel better, but a lot of times I find that the shockwave works better. That's how I do that kind of combination. Okay. So I do it after the first visit. And the reason is because I don't, unless they have done other treatments prior. So let me just explain. I had a patient here today in the office, and they had come in, they had seen someone else. They're here for a second opinion. They brought in their x-rays. They've done PT. They've done a cortisone injection before. Then I'm doing the ultrasound. I'm like, because we're going to go already to either shockwave or a cortisone again. Okay. And so that's when I jump to it. But the reason I do it mostly though, is when making the follow-up appointment, I put something in there. It's that says follow-up for plantar fasciitis, possible ultrasound. And so that's so my staff knows to give them the consent and prepare the ultrasound with the name of the patient and put that in the treatment room. Okay. So I hope that makes sense. So it's because it just saves me time. It saves me time by doing that, putting them in the okay. I don't know if everyone else does that, but that's the way kind of I do it. Okay. So they can give them the consent, they prepare them, and they also, when they read the consent, they know what the price is. So we put the price on there. Okay. So I also use for injections. What type of injections? I use for cortisone injections and then amnio injections. What do I do more of? I don't do many cortisones now that I have shockwave, but I still do them. Let's say in a first NPJ, I'll do it maybe in the plantar fascia or a midfoot, like the metcuneiform joint. And ultrasound works really well for like a metcuneiform joint, first NPJ, things like that. Because you can just see things a lot easier. I'll do it with a peroneal plantar fasciitis. For amnio, I do that for the plantar fascia, Achilles tendon, in all the tendons, like it's everything that everyone else does. But I find, especially the ultrasound helps me with the first MPJ, because sometimes, like in the past, I used to you can get it in there, but you have to try a lot of times and it hurts the patient. Same thing like with the midfoot, they're really hard to get. And with the ultrasound, you can see the effusion around the joint, the swelling around the joint, the arthritic changes in the joint at the second metcuneiform, third, things like that. It makes it a lot easier. And so with injections, so if I'm going to do an injection, I just charge them $50 for the injection with ultrasound, and insurance doesn't cover it. And then if I'm doing a full ultrasound read, then I will do $100. That's just the way I keep it real simple for my patients. And what moves me to do the amnio, everyone always asks about that, it's based on the ultrasound. So I couldn't do as much shockwave or amnio if I didn't have the ultrasound. The ultrasound is really what makes it a lot easier, because I can show them, one area is a lot thicker than the other, and then that's where I say, okay, what we're going to do is we're going to do three. This is my exact wording. We're going to do 3 sessions of shockwave. Okay, and at the second session, I'm going to do an amnio injection. Okay. And then I'm going to put you into a walking boot for a week, because I say I'm putting in, it's kind of like liquid gold, and I'm going to be putting in there, and I want you to rest it. So I'm getting the 3 shockwaves, I'm getting the amnio at the second visit, and then there's going to be a dispensing of a cam boot. Now, not everyone takes that recommendation. Okay. Some people say, hey, I just want to do the shockwave, and that's fine. So I'm getting the 250 per session of shockwave. We have the focused and the radial in our office, so it's 250, and then we have just the radial in the other office, and we charge 200 a session. And usually my patients, the way I explain it when we're talking about plantar fasciitis or shockwave, but what I say is I usually start with 3 sessions, and if patients have pain over 6 months, they usually need 6 sessions. If you've had less than 6 months, you usually do 3, but I start with 3, then I give you a 6-week break. And during that break, that's when you're going to go to physical therapy. So I usually, when I'm starting shockwave, I'll give them a script for PT so they can start that shortly after the 3rd shockwave session. Okay. So talking about money, I mentioned this a little bit already. If you're only doing an ultrasound guided cortisone, it's $50. If you're doing a limited ultrasound exam, it's $100 per location. The way I do it, just because I think it's fair, if they pay for one, in the future, I don't usually charge them. So for example, if they're doing one at the beginning of a treatment of plantar fasciitis before their shockwave, or before for Achilles tendon, I don't usually charge for the one. So let's say I do it in the beginning with plantar fasciitis. I do the 3 sessions. 6 weeks later, after they finish it, and they're coming back in, then I can compare before and after. So I don't tend to charge for those future ones. If insurance covered it, maybe I would charge every time, but in where I'm at, they don't. Okay. And then I usually bill an evaluation and management code with that as I'm doing that. So usually a level 3 patient visit. So some wording I use, ultrasound is less expensive than an MRI. I can do the ultrasound today in the office, and it'll help guide our treatment. And ultrasound helps me to see what's under your skin, and I can compare to the other foot. The key is comparing to the other foot. So I will I will do that. And many times I'll have them take pictures as well so they can see the difference. And they can expose. So this is one of the big keys is they do pictures with their cell phone. So there's a couple of things I have them do their cell phone for. When they're walking in a gated valley, it's a really bad one. I'll take their phone and I will record a video of them walking, and I can show them on their phone they're walking in their abnormal gait. I also have them take a picture when we're doing x-rays, so I can show them the really bad x-rays. And I have a normal printout of an x-ray too that's laminated that they can see, kind of comparing it to a somewhat normal foot. And then also with ultrasound, they take pictures of it. We used to print them out, but these days people just take everything with their cell phone. And the nice thing, if they just take a picture with their cell phone, if they share it, they're breaking their own HIPAA, and it doesn't really matter. It's not me that's sharing it. Another thing is I tend to package treatments, and I mentioned this before. So I do 3 treatments of EPAT, and on the second treatment, I'll do an amnio injection and then a 2-month follow-up. So this package will get me 4 visits. So I'll do 3 EPAT, and then I'll do the 2-month follow-up. So I'm making 4 appointments, and that's called bundling, when you're bundling visit appointments. Yeah, so that's something. Does anyone else have your staff do? I've thought about this. I haven't gotten the courage to do it, but like my thought is maybe I would do the first shockwave with the patient and then have the staff do the other 2 shockwaves. I don't know if anyone has other staff doing those. I think because some days I have 3 to 5 shockwaves, and then I think if I could see 3 to 5 new patients in that time. Does anyone do that? Does anyone have staff do shockwave for you? If you could write it in the meeting chat, I would love to know. That would be a good thing. I'm interested. And I want to share something, not that, oh, that's great. Wow. Yeah. So says someone else, I have staff do the second and the third. Good. Yeah, that's good. So you do the first and the staff do the second and the third. I think that I would feel comfortable with that. A lot of times they have so many questions. I sometimes think of like, and if I'm there though, I can just answer those questions. So thank you for mentioning that, Steve and Marty. Okay, so this is something that I use. You don't have to use, but I'll give you the link if you want to go to the person that I made. I had these make, but if you're going to make them, don't make like, I don't think I made like 5,000 of them, and I realized I put the wrong texting phone number on here. So if you want to use this, I'll explain how I use this. This is called my foot treatment checklist. And I use this and I fill it out when patients come in. So let me give you an example. So patient comes in, plantar fasciitis, put the date, pain level. I X what I did today. So this is the first visit. So they're going to get an x-ray, anti-inflammatories, icing, contrast baths, foam rolling, night splint, towel stretch, UFOs, custom orthotics, supportive shoes. Okay. And that's what they're going to get. And then I'm going to send them my patient education information on Patient Education Genius. And then I say to them, and I'm going to circle what I'm going to do next visit. Okay. So I circle the ultrasound, and then I circle the shockwave. So when I give this to them, they kind of know the plan of what we're going to do. So you can make your own. You can use mine. Just call whatever that printing press is. I'll give you their number. If you want to make your own, they'll put your logo, stuff like that. But this is, so I have the old fashioned prescription pads. I got one on Amazon, those little leather holder things, because we don't use prescription pads anymore, but I use this and I give this to them. And it really, really helps my patients, because they like to know kind of what the plan is. So I do this for most musculoskeletal things. And this is like version number 3. So you might as well start with my version versus messing up like twice like I did. The other thing that I use are these patient presentations. So if you haven't got these, let me kind of explain how this works. So I use it to prepare the patient for the ultrasound. So I'm going to show it to you in action. So the patient presentation tool, it's a link. You can go to patient presentations to get it. And I'm going to actually open up my screen and show you, this is the tool. This is the one that shows up for plantar fasciitis. If you want to know how I got here, I have this little link up top. It's called Patient Presentation Tool. And I pull it up for every patient, mostly new patients, but then the follow-up, I can also do that. So these are all the conditions that I treat in the office, and each one is linked to one of these. So we're going to do with plantar fasciitis, because that's something that everyone treats. And I go over this. You don't have to hear me go, but one thing that people didn't know, and I'm going to share this. So if you are using these, if you go down right here, and you can turn on the laser pointer and you can point. That's kind of a cool thing. So as you go through the slides, you talk about how long you've had symptoms, what treatments have you had, how does it impact your life, why do you want treatment? I go over the importance of equinus, of how it affects it. I talk about how it's white and it doesn't have the best blood supply, and that's why we do the shock wave. And I kind of pre-frame it, the reason for the shockwave and the reason for the foam rolling and the reason for the night splint. You can watch one of my YouTube videos if you want to see how I do that. This is the same slide, and I'll say, and here's an example of an ultrasound. We did an x-ray today, and I'll show them the x-ray. And this is the foot, this is the fascia, here's the fascia up here. Here you can see one side's thicker than the other. And my keywords are, and Mrs. Jones, if you're not getting better in 2 weeks when I see you, we're going to do an ultrasound to take a look at your fascia. How does that sound? Okay. I don't tend to go over price. I just say that's what, because I think that's what they need regardless of price. And then this is my money slide that I call the plantar fasciitis treatment evaluator, which goes over the treatments. And you kind of heard me go over it. And then each of these, if you didn't know this as well, if you want to explain more about stuff like shockwave, you just click this and it goes to my shockwave slides. And then if you want to go backward, you do this. This is how you get back. You have to click this button out on the upper left hand. You can't hit backspace or delete because it doesn't work. Okay, you have to hit the back button. And if I want to explain about the amnio injection, if I want to explain about custom orthotics, if I want to show them what an arrow spring brace looks like. So it has everything in here. And then now the other thing is for you, if you're using these, this is the black slide. This is the black slide that makes everyone think it's done, and especially for patients if they're looking at it. But then there's a whole other slide deck here. And this other slide deck has just more slides. And I use this when I record videos. So if I'm going to want to explain something in more detail, it's a whole other slide deck. And where these other ones connect to are further down in the slide deck. Okay, so let me just give you an example. It goes down to shockwave. And if I want to get back, I can go all the way back up and go through all the slides to get back to that other. There's a lot of these, sorry. And I don't do these on everyone, just so you know. This is just showing you kind of what's all, they're big. They're big, but they're mine. If you don't like it, you're not paying for them. So don't worry about it. They're I make them how I want. Okay. So that's the slide deck. Okay. And I just showed that to you. Then I also have an ultrasound slide deck. Okay. Now, why did this come up? Well, the one I share on plantar fasciitis is helpful, but when they come back for the second visit, they already know what's the plan. The plan is ultrasound. So I have one specific to ultrasound. So let me show you this one. So when they come in the second time, specifically for that exam, I pull up the ultrasound slide deck, and you can get that slide deck just by going all the way down. It says ultrasound, and it'll go right to the slide deck. Okay. So, and I say, and Mrs. Jones, you know, these are the typical things that I use for ultrasound. And the difference between this slide deck is when they hit plantar fasciitis, it has the normal numbers up here. So I just found what the normal numbers are. And then I have an example, the same example pretty much as before, but then I say, Mrs. Jones, let's look at yours, and yours is like double, like let's say it's 6 or 8 or whatever it is. Okay. And that's why I use these ones have the thickness in it for like the Achilles tendon and stuff like that. Okay. And then if you scroll down, then you're going to go over to my treatment evaluator. I just copied and pasted the same treatment evaluator. So when you're doing it, then you say, okay, you know, based on your Achilles, now these are the treatments. And a lot of times I'll have them. And another thing I like about this is it's much more objective, meaning, you know, I'll say, okay, what have we tried? Okay, we've tried anti-inflammatories, we've tried icing, we can't do a cortisone, you've tried PT, night splint. Okay, what's next? Well, shockwave and amnio are next. Okay, well, let's do those. And I've had many a time that a patient asked me, oh, and how about that walking boot thing? I'm like, oh yeah, I guess you can do the walking boot for the Achilles tendon. I don't usually always think about it, but you can. And so they're asking me to do things based on this. Okay, hope that makes sense. And so that's the one that's under the ultrasound diagnostic ultrasound within these patient presentations. So I have all these. I just added one today on pes cavus. So as I'm finishing these, I'll add ones to these. They're free for now, maybe not forever. We'll see if I ever charge for. They are kind of, you can if you join Practice Mastery, you can get the original slides and edit them. The problem with these, you can't edit them. So if you want to make your own, you have to make your own. You can't do that. Okay, let's go into the this is kind of the boring part. And then if you guys have any other questions, you can ask me or ask Marty, who's here. So I included in here, if you want our consent, here's our actual consent wording. So I just took out the signature thing was underneath because it took up too much space on the page. You can look at this after if you want to look at what I use for a consent. Okay, let's talk about documentation. If you want all of my templates, you go to podiatrypracticemastery.com/EMR. So let me just show you this. These are all my things. So these are like my table of contents for everything that's in here. Um, I don't know. I like doing these things for you guys. So my EMR templates for ABIs, AFOs, X-rays, medications, patient handouts. All my patient handouts that are in the EMR are down here. Patient handouts in English. Oh, these are Medicare ABNs, Spanish handouts, and all these things. Super bill, charging, ICD-10. So these are all within this thing. If you want them, they're just Google. Okay. So I put that in there. Part of this are these documentations. So let me explain this. So this is what my scribe does for me now, but he pulls up the plantar heel, plantar fasciitis template in the EMR. Green is usually normal. So plantar fascia is attached to the calcaneus proximally with no tears, effusions, or calcifications noted. Plantar fascia is within normal limits. And here it has the normal values in here. Examined, everyone is examined in the long and short axis, at least, most of them. And then all the abnormal pathology we say here, like plantar spur was noted with hyperechoic signal measuring, and you double click and you put the measure of the spur. Effusion of the plantar fascia noted. Thickening of the plantar fascia, how many millimeters? So we have one for the plantar fascia. Usually when you pull in the order, we use Athena for Achilles tendonitis. You pull in the order, and then you put in what side it is. You put if it's right, left, or bilateral, and then this is the probe that we use, and this is the brand that we use, and then if it's initial or repeat imaging, I'm sorry, this is really boring, but I told you I'd share this. Then the areas, so there's Achilles tendonitis at Achilles tendon at the insertion or at the mid substance, and it's pretty much all the same, like copied and pasted. We have one for neuroma. We have one for like second MPJ. We have one for first MPJ. We have one for the plantar fascia. We have one for the medial ankle, the tarsal tunnel. We have one for the lateral ankle. So all of them are pretty much copied and pasted. You can make your own, but I find making a template in your EMR makes it a lot easier for documentation purposes. And then if you do another tendon, like let's say it's the FHL or something else like that, and then soft tissue mass. And this is if there's flow going to it as well, or pulsatile flow, or if it's going into an adjacent joint or tendon sheath. It has that for like if you're looking at a ganglion. Okay. So I am finishing up here. I think this is going to be a shorter one because I didn't teach you guys how to do an ultrasound. I'd like you to put any questions you might have in the chat. I'm going to send you right now a little survey. I would like you all to, if you have a chance to fill it out, I think that would be a good thing. I'm going to send you, where's the survey? Let me get the survey so I can know if you're liking it. I feel like we're in podiatry school again, where everyone has to fill out a survey, but it's just a survey, your name, your email, what'd you like, what do you want to learn more about in the future? And if you refer a colleague, I'll give you a special gift because I want to tell more people about this. That's the survey. Once again, you can join this academy thing that I have for $20 for the first 2 months. It's basically free. Okay, come on, what's $20? You want to pay me the $97 a month? It's better. Okay, what did I give you here? So here's everything on here. Pick a time to meet with me if you want. Here's that special offer. Here are the slides to my presentation. I'm including that. Here's my EMR that I use, Athena Health. Here are my templates to the EMR. Here's my ultrasound I use 2020. The patient presentations. This is who does my treatment checklist. There's a link here, and my training manual is all here. So if you guys want to get all of this, you can just try scanning that with your cell phone. Now, if you're on your cell phone, you're kind of out of luck. But what you do is you just kind of scan it, and then in Google Chrome, it's going to open up this one. Let me just make sure it opens up the right thing here. Hope it does. Yep, it opens up the ultrasound thing right here. So you can just go through, and all these links are clickable. So in here, all the links are clickable. Okay, that's about it, guys. Does anyone have any questions? You can open up your mic, ask, tell me what works for you, what's working for you. This is always the awkward moment where no one says anything. No one writes anything. Okay, if not, I'm going to ask Marty to say something. You want to say something, Doc? Marty? Mark, to get the 2-month deal. Marty, I can't hear you. Are you talking? Okay. Let me see here. Did I turn this on the right? Let me turn. I don't think Marty's. Can you hear me, Marty? Okay. I think he's trying to talk. Maybe he can't. Okay. So let me try to get you guys. I'm going to stop sharing here. I'm going to end this here. I'm going to stop this recording.